And we're back talking about healthcare here in Canada. And Dr. Whatley, before the break, we were talking about some of the big picture numbers. And I made the assertion that our system is in crisis. You know, you can go online and people will chime in on social media, and sometimes they'll share their own personal experiences and they'll say, well, look, I got my knees done within, a fairly reasonable amount of time. And they would say that we're not in a crisis. Where do you stand on the issue? Do you feel that the system is in a crisis, or is it kind of overblown? What's your take?
Well, certainly, Colin, based on the data that you just shared here now and also other data, it's pretty hard to argue that we don't have a major problem. I would quibble a bit on the use of the word crisis. It's a bit like saying if you had a cancer diagnosis, I have a cancer crisis because I'm having treatment for 3 years. Well, or I'm having an arthritis crisis. We've been in trouble or in crisis for so many decades that it's hard to ramp up enough energy within the voting population, the rest of Canada, to actually care enough about this to have passion to create change. So we hear long-term care crisis, opioid crisis, mental health crisis. We hear of 4,300 patients cared for in hallways in Brampton Civic Hospital right before COVID. In fact, City Council voted unanimously to declare a state of emergency for hospital overcrowding right before COVID hit us. A patient in Sudbury was cared for 13 days in a bathroom. So I think crisis absolutely captures what patients are experiencing. The trouble is if we keep messaging it that way, people miss the fact that we've been in this crisis for 2 decades.
Hmm. Yeah, I mean, this is not a new thing that we're hearing of patients suffering. I mean, the media have reported on these stories for years and years and years. You had mentioned other numbers to look at. What are some of the indicators that you keep an eye on that makes you either concerned about what's going on, or maybe some areas where there's sort of, areas for optimism about what you're seeing?
Yeah. So we used to be able to live on the myth that Canada has the greatest healthcare system in the world. And that changed around 2014. The first Commonwealth Fund study, looking at sort of the most developed countries in the world, 11 different countries, and they ranked us, and Canada came second last, so just ahead of USA. And shortly after that, then federal Health Minister Dr. Jane Philpott spoke to a large crowd of us, and this was reported in the Globe and Mail, that she said, quote, "It is a myth that Canada has the greatest healthcare system in the world." So there was a paradigm shift around 2014, 2017. Commonwealth Fund repeated that study, and we bumped up one ranking, and then 2021 we fell again. And they were looking at things like quality of care, access to care, efficiency. Are patients getting the treatment that they need in a timely manner? And so now, in fact, in December 2022, perhaps you all remember this, Prime Minister Justin Trudeau said there's no sense putting more money into a broken system. So we do well on cancer care when you have a tissue diagnosis in hand, for example, but we do very poorly when you have an undifferentiated problem. So you're just in the long sprawl of waiting to actually find out what you have. I worry, though, about even saying anything too positive, because we hang on to the positive news and we forget the vast swath of patients that aren't getting the care that they need.
So speaking of the vast swath of patients that aren't getting the care that they need, Dom, you've been keeping an eye on patient stories across the country. We've been talking a lot about numbers. Let's talk about stories. What are some of the ones that stick out in your mind?
Yeah, I mean, how long do I have, Colin? There are too many stories to count of just tragic, tragic circumstances in the Canadian healthcare system. One that really sticks out to me is a woman by the name of Alison Duke Clouseau, a Victoria woman. She was diagnosed with cancer. The prognosis was not looking great, and there was a type of treatment that could have potentially helped her out. And the government said, well, the potential success rate just isn't high enough. So we're not going to provide you with the treatment. You can come and get assisted suicide, though, if you'd like. Allison was not, ready to deal with that. So she traveled to the US and got care. Thankfully she's doing better now, but just think about that. We've got a system where the government is offering assisted suicide instead of treatment.
It's pretty brutal. We'll be back with more in just a moment.